Hello, dear students. This is the end of our journey with inflammation. This is lecture number 7 and the last lecture. In this lecture, we are going to discuss the bacterial infections of the blood as a form of complications to the inflammation. So by the end of this lecture, we should be able to define toxemia and list its complications, to define bacteremia and mention its characteristic features, to define septicemia and list its pathological features, and also to define pyemia, mention characteristic features of both its types and the features of Pyramic Abscess. To start with, we have 4 main complications of spread of bacteria during inflammatory reactions to the blood. We have toxemia, bacteremia, septicemia, and pyemia. Each one of those has specific definition and certain characteristic features and has their own drawbacks or complications. So we will start first with toxemia. Let's start with toxemia. So toxemia means the presence of bacterial toxins in the blood. We have 2 forms of toxemia. It can be acute toxemia that happens with acute inflammatory reactions, or chronic form of toxemia that occur with the long-standing chronic inflammatory responses. So let's first start with the manifestations of acute toxemia. Acute toxemia can lead to fever, a headache, rigors, and pain. These are the first main manifestations of acute toxemia. Then we can see some effects on the parenchymatous organs, such as the liver, for example. We can see fatty change of the liver under the effect of this toxemia. We can also see in some of the powerful toxins inflammation of the cardiac muscle or the myocardium. This is called the toxic myocarditis. This happens with, as we said, severe toxic infections like diphtheria, commonly happening with diphtheria. So toxic myocarditis is a very bad complication. It may be fatal because this inflammation of myocardium or myocarditis can lead to heart failure. The heart can fail to do its function in an acute manner. So we can see acute heart failure as a complication, and this is a very serious situation. Also, we can see some focal areas of necrosis in some of the organs, such as the liver. This is also under effect of a spread of toxin. The same can happen to the adrenal cortex. And if there is a suprarenal or adrenal cortical necrosis, this can lead to a big problem, because from the adrenal cortex there is release of very important hormones that regulate the metabolism in the whole body, like the cortisone, for example. So these hormones like glucocorticoids or cortisone, if we have necrosis of the adrenal cortex, we will have a deficiency in secretion of very important hormones. So we will have a condition called acute adrenal insufficiency. What is the meaning of insufficiency? It means that the adrenal gland is not secreting enough hormone. It is insufficient for control of the body metabolism. So again, it's a very serious problem, and this can lead to death also. It can be life-threatening condition. Again, I want to emphasize that these very bad complications like toxic myocarditis, liver necrosis, adrenocortical necrosis, all of this is not a complication of any type of inflammation. It's happening with only severe conditions, severely toxic inflammatory reactions. The same also for the renal tubular necrosis. The kidney is having 2 main structures, a structure called the glomeruli and structure called the tubules. So in cases of toxemia, again, we can see necrosis of the tubules. Tubules are like the pipe system of the kidney. They are responsible about it's carrying the urine from where it is formed in the kidney to outside, to be collected and to be going to the ureter and then to the urinary bladder and then urethra and then outside the body. So we can see also in some cases tubular necrosis in both kidneys. And this is called the bilateral tubular necrosis. Again, this can lead to acute renal failure. So these are different features of toxemia, and the end result can be called shock. Because we said that before in the systemic effects of acute complication, that shock is like the worst case scenario in the severe septic infections that are having strong bacteria. We can see in the patient's complete collapse because of extensive vasodilatation in all the vessels of the body. So the patient will suffer of severe hypotension and maybe collapse and loss of consciousness. And in the same time, this may affect the multiple organs, and we can see multiple organ damage. So we saw here in acute toxemia different forms. We can see a condition of toxemia that is mild, like some fever, some headaches, and we can see some severe complications or very fatal complications of toxemia, such as necrosis in different organs or even septic shock or endotoxic shock. Let's now shift to chronic toxemia. Chronic toxemia, as we just said, it's a kind of a manifestation that will happen with long-standing chronic inflammation. First of all, patients with chronic inflammation will suffer also from fever, but it's usually mild, low-grade fever of long duration. And also they will suffer from loss of weight or cachexia, as we described in the previous lecture, under the effect of some mediators that cause loss of appetite or suppression of appetite, such as tumor necrosis factor alpha. Then we can see also as a form of chronic toxic problem the disease amyloidosis. This is caused by prolonged release of serum amyloid associated protein that is going to be deposited in multiple tissues in the body and lead to a disease called amyloidosis that we are going to study in depth in the chapter of disease of immunity. Also, prolonged suppression of the bone marrow will lead to a reduction of the rate of release or production of erythrocytes. So we can see in the bone marrow depression, we can see normocytic anemia. Anemia means that we have low count of RBCs and low hemoglobin levels. So this can happen because of reduction of production of RBCs from the bone marrow under the effect of the toxic mediators that are spread all over the body. The next complication of bacterial spread or spread of infection to the blood is bacteremia. From the name, bacteremia means spread of small number of bacteria in the blood. Why we said small number? Because we have another condition that includes the spread of large number of bacteria in the blood. So bacteremia means spread of a small number of bacteria, and they do not multiply significantly. So the rate of multiplication of this bacteria is very slow. So we can conclude from this definition that it is not a very serious complication. We are going just to see the bacteria in the blood. If we do blood culture, we are going to see the bacteria, but it's not going to be fatal or going to have very bad or severe complications. This condition of bacteremia usually happens with certain infections that are usually not very virulent organisms, such as Streptococcus viridans and E. coli. And also it usually happens in patients who have good immunity overall, not in patients who are immunocompromised. Okay, so overall this is a mild case of spread of bacteria in the blood. So as we said, as we agreed, we can only detect it by blood culture. The next form of spread of infection to the blood is septicemia. Septicemia means presence of bacteria in the blood also, such exactly as bacteremia, but The difference is here in septicemia, it's a more serious condition where we have high number of rapidly multiplying bacteria that are very highly pathogenic and very virulent, very strong forms of bacteria. So septicemia is like the very bad form of bacteremia or the very serious form of bacteremia. Septicemia can be caused by powerful organisms, as we just mentioned, like the pyogenic cocci and some bacilli of plague and many other examples of strong bacteria. It's a very serious condition that usually leads to severe toxemia, and also it can end to septic shock. If it is not properly treated, actually it's an emergency situation. We can see in those cases the bad fate or the serious fate of the toxemia, such as massive adrenal cortical hemorrhages, necrosis. We can see also necrosis of different organs like the kidney and the liver. And we can see another problem that we discussed before, which is disseminated intravascular coagulation. This happens under the effect of certain mediators, and this happens because of stimulation of coagulation cascade that will lead to widespread microthrombi in all the microcirculation of the body. So this is called the disseminated. Disseminated means very widespread. Intravascular, because it is inside the vessel. Coagulation, because we have many thrombi inside the vessels. Thrombi mean like plugs or like clots. So disseminated intravascular coagulation, or DIC, is a very bad complication of septicemia. Let's start to explore the different pathological features of septicemia. The first complication of septicemia or pathological feature is Petechi. What is the meaning of Petechi? It is the presence of pinpoint or something like spot hemorrhages all over the body. These hemorrhages can be seen in the subcutaneous tissue or on the skin, and also can be seen in the internal organs. This widespread hemorrhagic lesions or hemorrhagic spots are because of the complication we just mentioned, which is the DIC, disseminated intravascular coagulation. What happens actually that in all the microcirculation vessels have plugs or thrombi. Under the effect of these small plugs, they will rupture, the vessels will rupture and will form small spots of hemorrhage everywhere. So this is one of the manifestations of septicemia. Another manifestation is pleuritis or pericarditis. The serous sacs or the serous membranes of the body, like the pleura and pericardium, are always very reactive to any widespread inflammation or infection in the body. So we usually see pleuritis or pericarditis or sometimes peritonitis in cases of septicemia, and that usually the type of inflammation is serous or fibrinous, or a mixture of both, serofibrinous. The third complication that we can see in septicemia is called the acute splenic swelling. Spleen is one of the organs of the reticuloendothelial system, or one of the lymphoid organs. It has inside, it is formed of two microscopic regions. It's formed of a white pulp on the near the surface. This is formed of lymphoid follicles, and the core or the center is formed of red bulb. This is formed of vascular channels called the sinusoids. What happens in the spleen in cases of septicemia? We have the sinusoids are going to be congested, dilated inside the spleen, and they are going to be filled with a lot of inflammatory cells, acute and chronic inflammatory cells. This dilatation of the splenic sinuses will lead to enlargement of the spleen. And that's why the spleen will be swollen or larger in size. If we look at the spleen grossly, it will be enlarged. And if we are in autopsy, if we are examining the patient after death, and we hold this spleen and touch it, we will find it very soft. And if we open the spleen, the cut surface will be soft or semi-fluid even. And if I put it under the tap water, it will be washed away. This is because of the extensive vascular congestion and the inflammatory infiltrate. Also in the same case or in the same condition, we will see some atrophy, which means that we have some loss or some reduction of the size of the white bulb, which is surrounding the red bulb, which is at the periphery of the spleen and formed of lymphoid follicles. So this is what we mean with acute splenic swelling that can happen in cases of septicemia. The next complication of septicemia is called acute bacterial endocarditis. Acute because it happens with acute conditions, bacterial because it happens with bacterial action. Septicemia is a bacterial condition, and endocarditis means inflammation of the endocardium. What is the endocardium? It is the innermost layer of the lining of the heart. And it is also lining inside the heart. We have structures called the valve. This is like a partition between the chambers of the heart. The heart has 4 chambers, 2 chambers called atria and 2 chambers called ventricles. This is an example of an atrium, an open atrium, and this is an open ventricle. And in between we have structure like a partition called the valve. All these structures are covered by thin layer called endocardium. In cases of septicemia, we have inflammation of this endocardium, and we will see sometimes aggregates or clumps of the bacteria with some platelets and fibrin over the valves in the cases of the acute bacterial endocarditis. This is again a very bad or fatal complication, the acute bacterial endocarditis, because this leads to destruction of this partition, this valve in the heart, and this will lead to severe circulatory problems and may lead to heart failure in some of the cases. The last complication we need to talk about in septicemia is called the massive adrenal hemorrhages. In the adrenal gland, we see a lot of adrenal hemorrhages in cases of septicemia and sometimes necrosis, and this is also can be fatal. Again, as we agreed before, because manipulation of the adrenal cortex is very dangerous, as the adrenal cortex is responsible about production of very important hormones, the glucocorticoids and aldosterone and many other hormones that are controlling many metabolic functions in the body. So any manipulation or any problem or interference with the functions of adrenal cortex can be at some point fatal, or at least it can be very dangerous. So these are the 5 manifestations of septicemia or pathological manifestations of septicemia, the most important, but we obviously have other manifestations. So let's revise. So again, the septicemia is a condition of presence of high number of rapidly multiplying pyogenic powerful bacteria in the blood, and it can lead to petechial hemorrhages all over the body, which means spot hemorrhagic lesions. We can see acute bacterial endocarditis, which means acute bacterial inflammation of the endocardium, which is lining the heart chambers and the valves in the heart, and this can lead to acute heart failure in many of the cases. We can see massive or widespread adrenal gland hemorrhages. We can see pleuritis or pericarditis, inflammation of the serous sacs, and this can be of the serous or serofibrinous types. And we can also see acute splenic swelling. Acute splenic swelling grossly will appear as enlarged soft spleen with semi-fluid cut surface, as we said. And under the microscope, we will see atrophy of the lymphoid follicles, which are in the white bulb, and the red bulb of the spleen will show dilated, congested sinusoids. Sinusoids are vascular channels, and they will contain acute and chronic inflammatory cells in very large number. So hopefully that we can understand now the different pathological features of septicemia, that many of them can be appreciated only in the post-mortem state. Post-mortem means after death or during performing an autopsy, which means dissection of the patient and gross examination of the organs after death. The last but not least complication of bacterial infection of the blood is called pyemia. Pyemia means we have dissemination of small septic emboli in the blood. Let's stop and analyze this definition. What is the meaning of septic emboli? In the blood, as we saw before in septicemia, we can see bacteria wandering around in the circulation. Sometimes the bacteria will form like small masses or clumps that are aggregates of the bacteria together with some platelet and some fibrin and some RBCs. All of them are making a mixture that is making a solid mass, small group or structure. This small structure will travel in the circulation. This is called an embolus. And if we go to the plural of embolus is emboli. So this is the meaning of emboli. By the way, you have a whole chapter of circulatory disturbances coming later on. You are going to study in this chapter the meaning of thrombi and emboli. So don't worry about these definitions. You will have more details about them very soon. So here we have emboli, small masses of or aggregates of platelets, fibrin, and RBCs, in addition to bacteria traveling in the circulation all over the body. This is why they are called septic. As we said before, the word septic means infected by bacteria. The problem of these emboli, they are going to travel in the circulation. At some point, they will reach a small blood vessel in which they will be stuck and they cannot proceed further according to their size. So they will finally be stuck at some points or stop at some organs, and when they stop, they will start a focus of inflammation around them because they are infected, they have bacteria. So if they stop inside vessels, they will create around them small foci of inflammation in the form of small abscess, many small abscess. Or even they can stop the blood supply to this area where they have blocked completely the vessel in the area. So we will have an area of the tissue that will be dead, which is called infarct or necrosis. And this will be an infarction that is infected also. So it will be called septic infarct. So again, let's repeat the definition slowly. So in this case of pyemia, we have widespread of small septic emboli, which means small masses of groups of platelet, fibrin, bacteria, and RBCs clumping together, circulating in the blood. They will move around until they reach a very small vessel. They will stop at this vessel and will do one of two things. Either they will start a focus of inflammation around them and will create small abscess, which will be called the Pyramic Abscess, or they will stop the blood supply to certain area supplied by this vessel, so they will cause infarction or necrosis of the tissue that will be infected because of the action of the bacteria. So they will lead to septic infarct. So let's have a look here on this photo of a kidney that shows many small yellow spots. Actually, those are multiple or numerous small Pyramic abscess. Every one of this was a small embolus that is infected, and it started an abscess around it. So this is the feature of Pyramic abscess. Pyramic abscess are usually like this. Small, multiple, pinpoint or small sized, and they will always have a yellow center and a congestion zone around them. So again, this is a very good presentation of the Pyramic abscess. They are usually multiple, nearly same size, small size, and they usually are yellow in color because of pus formation and surrounded by area of congestion representing the vascular phenomena at the periphery of the abscess. This is how they look like. So now, after we explored the definition of pyemia, the meaning of pyemia, presence of septic emboli, and we have explained what is the meaning of emboli, and we know the effect of pyemia. It will lead to small abscess or septic infarction or infected infarction, an area of tissue that is dead. Now we have to know that pyemia has two main types according to the origin, where they originate, which area of the circulation. Is it originating in the systemic circulation or in another compartment of the circulation in our body? So our circulation, the main one, the systemic circulation, usually starts by venous drainage from the different organs. This venous drainage will include deoxygenated or blood or having very low oxygen level. This blood will go to the right side of the heart, then to the right atrium first, then to the right ventricle, then to the pulmonary circulation, to the lung. Why it's going to the lung? Because it will get aerated and it will get the oxygen from the lung. Then we will have back from the lung arterial blood that is having high oxygen levels, back to the left side of the heart, left atrium, then left ventricle. Then the blood will go to the aorta, our largest artery in the body, and then it will be distributed to the different organs. This is the systemic circulation, very simply. And here also we have a small circulation, a compartment called the pulmonary circulation. We have another circulation in our abdomen called the portal circulation. This is happening when we have some venous drainage from the gastrointestinal tract, like the large intestine, like small intestine, stomach, pancreas, spleen even. They will drain their venous blood into one single vein, which is called the portal vein. This will give the blood to the liver. And then from the liver, the blood will be filtered, detoxified. Many of the components that are coming from the digestive tract are being worked upon, and then the blood will go back to the systemic circulation. So this is called the portal circulation. With these concepts in mind, we can classify pyemia into two main types: systemic pyemia and portal pyemia. Systemic pyemia means that the problem, the infection focus, started in any place in the systemic circulation, and the Pyramic Abscess or the let's say the septic emboli are going to travel in the main systemic circulation, and they are going to stop somewhere. So let's think, if for example I have a focus in the bone of the leg, let's say, and this focus started a septic emboli. It is sending small fragments of bacteria that are being grouped with platelets and fibrin, small septic emboli in the systemic circulation. Where is the first station? Where is the first capillary bed that will meet this septic emboli? Let's see. If this is a septic embolus, it's coming from the leg. It will go in the venous circulation. This is all an open way. Then it will go to the heart. It is open chamber. Atrium, ventricle, then another vessel, the pulmonary vein, a pulmonary artery, sorry, and then it will go to the lung. Here in the lung, it will be stuck because in the lung, it will meet the pulmonary microcirculation. This is the pulmonary bed of capillaries. So it will be stuck usually in the lung. So mostly the abscess that are going to develop in this side of the circulation, in the venous side of the circulation, they will send the emboli to the lung. So this is our first option, emboli that are starting from the venous side of the circulation. All of these are going to meet or be stuck in the lung. This is option number one. We have another option. Suppose that we have an infection that was inside the left side of the heart here. For example, something on the valve, like we just mentioned something called the acute bacterial endocarditis, inflammation on the valve, for example. If this inflammation started a septic focus and started to send the emboli, where exactly these emboli are going to go? Let's go with the flow. This is a focus starting to send septic emboli. It will travel with the arterial circulation in the aorta, and then it will be distributed to different organs in the body. So it may be stuck, for example, in the brain, in the liver, in the kidney, spleen, anywhere, right, in the arterial circulation. So this is the second option in the systemic pyemia, that if we have emboli arising in the arterial side, they will be distributed to any organ. So this is the main difference. Emboli arising from venous side, the first tissue they will meet is the lung only. So they will create Pyramic Abscess in the lung. Emboli arising from the arterial side, the first tissue they will meet actually is any tissue, because the arterial circulation will be distributed all over the body to give the oxygenated blood. So we can see emboli here over anywhere, any organ in the body. These are our two main options. Then what about the portal circulation? If we have a septic emboli that started in any place in the intestine or appendix or even the stomach, and they send the emboli to the portal vein, where they will be stuck. They will be stuck in the liver. So it will be leading to Pyramic abscess in the liver. So any embolic septic embolus starting in the portal circulation, it will usually lodge or be stuck, impacted in the liver. So it is a very simple concept. It all depends on where it will start, where the septic focus or the inflammation, the original inflammatory focus is. Where it is, then the next step only you need to think or to go with the flow, to go with the circulation. Is it in the systemic circulation, in the venous side, or in the arterial side, or in the portal circulation? So knowing the concepts of the circulation will help you to understand where exactly the emboli are going to be stuck. So let's try to put that into sentences. So we have two types of pyemia, systemic pyemia and portal pyemia. Systemic pyemia, as we said, it's a pyemia in the systemic circulation. Portal pyemia is pyemia in portal circulation. Here, the septic emboli in the systemic circulation are going to arise depending from many organs. Actually, here we have some examples. These examples may look for you having some tough names sometimes, but they are actually simple. For example, let's say here, osteomyelitis. Osteomyelo is the bone and the bone marrow, right? So this is inflammation of the bone and bone marrow, osteomyelitis. We have a condition called acute hematogenous osteomyelitis. So this is inflammation of the bone. If we have inflammation of the bone, this will lead to drainage of this inflammation in the form of septic emboli that will travel in the venous side, so they will be stuck in the lung. There is another inflammatory disease in the uterus called Purpural Sepsis. This is a severe uterine inflammation happening after labor. After a lady is pregnant and then she delivered, sometimes there is inflammation of the uterus. If the uterus has this inflammatory focus, the emboli will travel in the venous circulation and also will reach the lung eventually. Again, let's say if we have otitis media. Otitis, oto is the ear. Media is the middle ear. So sometimes we have inflammation of the middle ear. This is common. Inflammation, it happens a lot in children. So again, it will drain the inflammation. It will be drained, and we will see the spread of bacteria in the blood in the form of septic emboli, and this will travel in the venous side of the circulation that will reach finally to the lung. So these first three options are going to be mainly stuck in the lung. What about those? Suppose that the abscess already, or the problem already, is in the lung. Then what is the next station after the lung? As we saw in the previous slide, if it is starting in the lung, it will be then traveling with the arterial side of the circulation to the left side of the heart, then to the aorta, then to the different systems. Or if it started in the heart itself, in the left side of the heart, again it will travel to the systemic circulation in the arterial side directly. So those two last options will actually give the emboli to the arterial side, not the venous side. This is again depending on what we understood in the previous slide according to the circulation basics. So these diseases, we have some, for example, called suppurative lung diseases, inflammations of the lung that are associated with suppuration, like abscess, for example. Or we have this condition of acute bacterial endocarditis that we mentioned before, that can happen on the valves of the left side of the heart more commonly. So these are the concepts of systemic pyemia. What about portal pyemia? Portal pyemia, as we said, when we have septic emboli in the portal circulation, they will be carried to the liver. Like acute suppurative appendicitis, inflammation of the appendix. Like infected piles. Piles or hemorrhoids is a condition that is having dilated veins in the like the lower rectum. So this is very common, or around the anus. So infected piles sometimes will lead to a spread of infection through the portal circulation and spread of Pyramic Abscess in the liver. Also, sometimes if we have suppurative inflammations of the gallbladder or the large intestine, again, all of that will be drained by the portal circulation and will reach finally to the liver. So again, let's say the same concepts. So systemic pyemia, any emboli arising from the venous side will produce Pyramic Abscess in the lung. Any emboli that are arising in the arterial side, this includes the lung itself and the left side of the heart. These will be distributed all over the body and give Pyramic Abscess to brain, liver, kidney, or any other organ that is receiving arterial circulation. If the emboli are in the portal circulation, they will be stuck or arrested in the liver, producing here the multiple Pyramic Abscess. Now, after we completed all the different types of bacterial infections of the blood, we can go to our activity zone. In this activity, we have the different types of bacterial infections and their definitions. So please, I want you to stop the video for maybe a few minutes and read carefully the definitions, and then we are going to connect the term or the type of bacterial infection of the blood to its suitable definition. So let's start with pyemia. What is the meaning of pyemia from all of these explanations? Pyemia means dissemination of small septic emboli in the blood, which will cause the effect, which is either Pyramic abscess or septic infarction, wherever they are lodged or wherever they are arrested or stuck. Great. What about bacteremia? Bacteremia means spread of bacteria, right? But which type of bacteria? Bacteremia means the spread of small number of bacteria that usually do not multiply significantly. Then we have toxemia. Toxemia means presence of bacterial toxins in the blood. Finally, what about septicemia? Septicemia means presence of rapidly multiplying highly pathogenic bacteria in the blood. So I hope that we understand very well this concept, the difference between the four of them, because this is very important and we have explained a lot. The next activity here is to describe or to label the different effects of septicemia. We mentioned effects of septicemia before. Can we give names for each of these photos? First, we have these spot hemorrhages in the skin or the internal organs. This is called Petechi. Good. And then we have inflammation of the serous membranes like the pleura and pericardium. This is called Pleuritis or Pericarditis. Then we have the enlargement of the spleen in acute condition. This is called acute splenic swelling. Then we have the inflammation of the endocardium of the heart, especially on the valve, in an acute form also. So this is called acute bacterial endocarditis. Then we have the extensive hemorrhage of the adrenal gland, massive adrenal hemorrhages. So, that was our last lecture together in inflammation. I hope that it was a good series of lectures that will be beneficial and helpful for you. And I want to wish you all good luck in pathology and the best wishes. And also, please contact me anytime if you would like to ask about anything. I can be available also in the college. This is my email, and hopefully that I can be helpful anytime in anything related to pathology for all of you. Thank you very much. It was a lovely journey, and hope inshallah to meet you again in another set of lectures later on بإذن الله. Thank you and goodbye.